Good morning.
Good morning.
I want to welcome you to the Roy Branson Legacy Sabbath School class, which is here in sunny Southern California. My wife and I went to Mammoth over Christmas, and we got out of Mammoth fine. We got down to Ridgecrest fine. We got south of Ridgecrest, and they were pulling trucks up over the grade there with tow trucks, 18-wheelers. And then we got down to Adelanto. And at 2,800 feet, and it was snowing like crazy. I thought I was in Michigan, where I grew up. But, you know, blind squirrel always gets a few nuts. And so the Friday before we went, I had bought new tires for my wife's car. They were all-weather tires. And she has an all-wheel drive vehicle. And we made it. So, but anyway, I guess the Grapevine and Cajon Pass were really a bad situation. Well, yes, but when we went through the Cajon Pass, it was wide open. I mean, it was just, so it must have been earlier in the day.
Traveling mercies.
Well, I guess Las Vegas really got hit because between Baker and the state line, it was ice. They closed the road down there too. So I'm sure Las Vegas casinos aren't going to go broke because of that. Okay. By the way, I just want to mention that Dr. Brandstetter is in hospital. He would like our prayers. David went to visit him this week, yesterday? Or
Yesterday.
Oh, today? Okay.
Yesterday.
Oh, yesterday, okay. And he's in there, and spirits are good. I'm sure that he would appreciate a note, or, you know, obviously your prayers would be, he would appreciate that. So, I won't mention how old Dr. Brandstetter is, but he's older than I am. And he's up there, so we need to remember him. I want to mention next week, here at our class, Thomas J. Oord, O-R, is that a Dutch name? I think it is. Anyway, he will be speaking here, nature, theology, and photography. And then in the afternoon, he'll be making another presentation at 3 o'clock. I have flyers here on the desks there, and I think we have some back there as well. So anyway, okay. Again, we want to welcome Monte to number 2.
Thank you. Number 2.
Yeah, by the way, I want to mention one thing. I did mention about his lovely braces last week. He is like I. That when we buy those Trafalgars, we usually get those on eBay. And they're a lot less expensive than if you went down to some men's clothing store. So someone has probably worn those.
Yes.
At some time. And probably their, whatever your theology is, their spirit might be enjoying that we're wearing them. So anyway, we're going to turn this over to Monte again. And next week, again, we'll mention it one more time. So let's just bow our heads. We thank you today that we can gather for the safe trips and for families. Be with Monte in a very special way. Also be with Dr. Brandstetter. We would ask your will be done. And now, bless this meeting today. We pray in your name. Amen.
Good morning. My presentation is titled Poverty and a Living Wage, Adding Things Up. And as most of you just heard, and most of you already know, it's a 2-part presentation, so this is the second part. And I'm using that phrase, adding things up, because when I'm looking at poverty and living wage, I'm going to be looking at it from a dollars and cents perspective. There are other perspectives we could take on that, but not in this little series. So this morning what I want to do is start out with a thought from 2 Nobel laureates, and then give you a brief rundown of where I come from, followed by a brief recap of the Making Ends Meet study that we talked about last week. That's a study on the border between welfare and low-wage work. And then I'll go over a few conclusions and implications of that study, and finish up with what I see as a related topic, a living wage in California. So I want to start my talk with a thought from an economist couple, Obijit Banerjee and Esther Duflo, who together with Michael Kramer won the 2019 Nobel Prize in Economics, which was this last fall. All too often, the economics of poverty gets mistaken for poor economics. Because the poor possess very little, it is assumed that there is nothing interesting about their economic existence. To progress, we have to abandon the habit of reducing the poor to cartoon characters and take the time to really understand their lives in all their complexity and richness. So where do I come from? And maybe that's a little bit of a reason why I ended up here in front of you. I grew up in the Central Valley of California, attended Pacific Union College and earned my interdisciplinary studies degree in 1988. I then earned my Master of Social Work at the University of Utah in 1990. Went to work for a little while, which we'll talk about in just a moment, and then came back to University of Utah and earned my PhD in social work in 2003. My post-MSW career as a social worker began right here in Loma Linda at the Loma Linda University Church. I then worked for the Utah State Division of Aging and Adult Services, then Adult Protective Services in the Salt Lake region, then moved to Pacific Union College and taught social work and filled several administrative positions within the Department of Psychology and Social Work over an 18-year period. I then came to Loma Linda University 5 years ago to teach social work to master's students. One of the reasons I give some of that background is right now my research focus is in the area of Medicare policy, and I teach in the area of research, neither of those having to do a whole lot directly with poverty. While I was at PUC, and I'm a gerontologist, while I was at PUC, and I'm trained as an administrator. My master's had a focus in administration, and I also had an emphasis in gerontology. Went to PUC and I didn't teach administration or gerontology. So I ended up, that's what we do at undergrad level. We often teach the classes that are available. And so over that 18-year period, I really did focus on poverty and services to people who are on the margins. And so I pulled from that experience for our presentation today. So let's recap the origins of the study that we discussed last week, Making Ends Meet, How Single Mothers Survive Welfare and Low-Wage Work. The research was conducted by Catherine Eden, a sociologist, and Laura Lane, an anthropologist. Their data for the study was collected between 1988 and 1992, and this is an important time period, or that time period is important because it was just prior to the 1996 Clinton-era welfare reform. At that time, prior to 1996, welfare was still an entitlement. If you were poor enough, you could receive welfare benefits, because that is if you had children. Because of this, the movement of from welfare to work was a decision recipients made rather than a forced choice resulting from benefit time limits, and those came in 1996. Come back to that in a little bit. The purpose of their research was to explore the full range of incentives and disincentives that low-skilled single mothers perceive and act on when making the choice between welfare and work. I think the study helps us answer a question asked by Eden and Lane: why not just go to work? Or is it sometimes it's called work first? That's what we got with the 1996 welfare reform, work first. Why not just go back to work, even if it's a low-wage job? Well, why not? What Eden and Lane found was it's because welfare-reliant mothers were consciously weighing the costs and benefits of such a decision. Experience, and remember the welfare-reliant mothers, so the mothers that they interviewed, who were currently receiving welfare benefits had on average 5.6 years of work experience. They had work experience in the low-wage sector, so they knew of what they were talking. Experience told them that they would be worse off if they moved to a low-wage job given their current circumstances. It involved a number of things. They would risk serious hardship for them and their children. And I want to expand on that point just a bit. Low-wage work-reliant mothers experienced 50% more hardship than welfare-reliant mothers in the study. I'm going to say that again. Low-wage work-reliant mothers, those who had taken a low-wage job, experienced 50% more hardship than the single mothers who were welfare-reliant. And these mothers knew that because they had experienced both. This in spite of the fact, and so now we're talking about the low-wage work mothers, in spite of the fact that work-reliant mothers had more family, friends, fathers, boyfriends, community infrastructure available to help them make it possible for them to survive on their low-wage jobs. Things like low or no-cost housing, free childcare, financial help, health insurance for their children, usable and affordable public transportation. Those are types of things we call social capital. And one of the things that Eden and Lane found was that distinguished those single mothers who were low-wage work reliant and those who were welfare reliant is those that had made the transition to work had more social capital. So one of the key conclusions was it's a decision, and the mothers were able to make the decision to move to work when they had more social capital. So now imagine taking welfare-reliant mothers who don't have social capital and moving them into low-wage work. Remember, those that did have the social capital experienced 50% more hardship in making that transition. Now you take people without social capital and you force them into low-wage work. What level of hardship is the family likely to suffer? And this is exactly what we did with the 1996 welfare reform. We pushed people, we no longer let them make that decision, but forced it. And we did a few things to try to add some social capital in there. One of my concerns about that was this very temporary social capital. So, for example, childcare. But then the question is, how long is that childcare going to last? And do we expect people to then earn enough money to afford that childcare down the road? Or is that childcare even eligible? And there is good news on this front. I just found out, about a month ago, I looked into this a bit more because when I was up north, so back in 2014, last time when I gave a talk kind of like this, the waiting list in Napa County for childcare, even if you were eligible for it, was about 2 years. So yeah, go to work, and in 2 years we'll get around to giving you low-cost childcare. A number of things have changed since then, and in San Bernardino County, I was talking to a person who runs the program out of Redlands. We've done a number of things in California, and we actually do have child care that's available to people for 48 months. It's not ideal, but pretty much it's available, no waiting list. If someone's eligible, they're able to get that child care. So that's a big change. And so that's helped with that transition. And I think it's one of the conclusions that I come to overall is, well, how do we help? Well, providing some of the social capital that people don't have is one of the solutions. So what else did their experience tell them? Well, it told them that low-wage jobs involve work insecurity. Being 3 times more likely to be laid off, irregular work hours, no guarantee of hours, and no paid vacation or sick leave. And so if you think about that, single mother with no paid vacation or sick leave, if your kid's sick and can't go to school, you're really stuck. And finally, even if they went to work, they would be less likely to make ends meet. Those of you who were here last week will remember that the gap between income and expenses was greater for low-wage work-reliant single mothers than welfare work-reliant welfare-reliant single mothers. So they actually expected that gap would become greater. They knew that these problems would not likely get better over time because low-wage jobs frequently lack advancement opportunities. And finally, welfare-reliant mothers had a very real fear of jeopardizing the safety and well-being of their children. Their decision was not primarily about getting more income. Instead, they were balancing income needs with the nurturance and supervision of their children. And that came through time and time again in their interviews. So to wrap up our overview of Eden and Elaine's study, let's look at a few of their key conclusions. Neither option, reliance on welfare or reliance on low-wage work, offers single mothers enough to pay their bills. Network strategies or social capital are conducive to moving from welfare to work. And mothers do not freely choose the strategies they employ. They are constrained by social structural characteristics of their environment, for example, low-cost commuting, and in the 4 communities that they conducted their studies across the country, they found that there was a great disparity in the access to public transportation, for example. And they were constrained by level of social capital that they happened to have. So, makes sense. You don't just create access to low or no cost housing. You have to have family, for example, in the area. And childcare was another key piece of social capital that many of the work-reliant single mothers took advantage of. So I hope you'll remember some of the details about this study if you end up in a conversation with someone about people relying on welfare. I know I do at times, and I think it's good just to be able to give perspective, because oftentimes those discussions don't involve much perspective on what it means to be on that border between welfare and work, and what it takes to move from one to the other. All right. Last week and this morning I promised that I would talk about a living wage, and so now it's time for me to keep that promise to you. Last week I asked the group to answer this question about a living wage, and I'll come back to your response in just a moment. But I think a few of you were not here last week, so if you'll take a moment and answer this question for yourself, and the rest of you can revisit it if you would like. How much would it cost a San Bernardino County mother and her 2 children, one in daycare, to purchase, without government benefits or support, a basic standard of living? How much would it cost without government benefits or support? Okay. So just keep that in mind. And this, on this chart, I have it in current dollars, 2019 dollars. In our discussion, we're going to be adjusting that to 2017 dollars. All right, so we're going to talk about the correct answer on that in just a moment, but first I want to put that into some context, the living wage. And so those of you who were here last week will remember this chart. You can see that on the y-axis we have monthly income, and on the x-axis we have several levels and amounts of income, different types, what you would have if you were at the federal poverty level in 2017 and you were a single parent with 2 children, the minimum federal wage and the minimum wage in California, and then the maximum benefit possible to a family of 3 if you took welfare and added that to food stamps, and that's the maximum benefit possible. So what we want to do is, that's a context for us. We want to put minimum wage, or excuse me, the living wage in there. So we'll shove these over a little bit and make a little room. And my hope is that a living wage, and I believe it's going to be, a little bit more than $2,000. So we're going to have to squish these guys down and make a little room for some more income. And we've got living wage spot ready, and when we bring that in, we find out that the answer to the living wage, and this is 2017 dollars, or 2017, yeah, dollars. The answer to your minimum wage question was $29.58, or $56,788. It was the final answer in 2019 dollars. Now I've switched it, adjusted for inflation back to 2017. So that comes out to $27.30 per hour and $52,416 per year. That's the living wage in San Bernardino County in 2017. So if you're anything like me, you have a lot of questions about that number. And how in the world do we come up with that? It looks like a pretty big hourly wage and a big annual salary. How did they come up with that? I'll go over that in detail, budget line item by budget line item, so you get a sense of that. It's what I would call a fairly conservative budget. And I did a few things on my own where I had choices and kept it conservative in terms of number. It could be higher. But other context that I'd like to bring out. If you're looking in 2017, you were only counted as poor if your income was at or below $1,701, which is about 33% of the living wage in San Bernardino. Working a minimum wage job in California, 8 hours a day, 5 days a week, got you close to about the same thing, 32% of a living wage in San Bernardino. So they're working for a living, but not earning a living on the California minimum wage. And receiving the maximum welfare benefit plus food stamps gave you just 26% of the living wage in San Bernardino. So here are the responses from last week. Those of you who answered the question last week, 72% underestimated how much a basic standard of living would be. But 30%, close to 30%, we're right on. So now let's go over the California Budget Project. That's where I got my information, where they came up with these numbers, and we'll adjust them to $2017. So I hope you notice a connection. The Making Ends Meet book, the study that we just have been discussing, was published in the early 1990s. Making Ends Meet. California Budget Initiative is Making Ends Meet, and the authors of our study launched a nationwide effort. This was happening in state after state. California was one of the early states. Now pretty much in every state you can find out how much it costs to live in different counties, and it's actually become quite automated now where you can just go in, plug in your county, plug in a few other things, and it pops up. But this is, the California Budget Project's been doing this for a fair number of years soon after the Making Ends Meet study was published. So here's the question that the California Budget Project was trying to answer with this Making Ends Meet project. How much would it cost a San Bernardino County single parent to support themselves and their 4- and 7-year-old children through earnings alone, without government benefits or support? And they had different line items. They looked at housing and utilities, food, child care, health care, transportation, miscellaneous expenses, and taxes. And we'll go over each of those, how they calculated those budget amounts. And just an aside, in this report, they also looked at 3 other family groupings. Well, not family on the first one. A single adult, there's an analysis for single adult, an analysis for a 2-parent family with only 1 person working outside the home, and a 2 working parent family. And then they ran those 4 analyses for every county in the state. And so I pulled out San Bernardino County numbers. All right, so now let's look at the information line by line. Start with housing and utilities. And the figure that they came up with housing and utilities is based on fair market rates from the Federal Housing and Urban Development Agency. They priced a 2-bedroom apartment, which is the HUD standard for a family of 3. And they based the cost on rent on the 40th percentile of recent movers. One of the things that's interesting in getting into one of these studies is you find out how much data is collected out there. So specific data on people who have moved recently, and you can pull that out and figure out, okay, currently how much are people having to pay to afford rent? And so 40th percentile, meaning the 40% of people who recently moved paid less than this amount, but 60% paid more than this amount. So that's one of the examples where I'd say it's a conservative estimate. Didn't go at the very bottom, didn't go at the very top, didn't even go at the middle, but a little bit below the middle. They calculated that the basic rent, well, actually we're going to keep track on a running grid here for what the living wage is, and then we'll keep track of percentages as well. So what they found was that rent was $1,197, which accounted for 25.3% of the monthly budget for housing and utilities. They based the food budget on the U.S. Department of Agriculture's low-cost food plan. That should sound familiar to some of you. As we discussed last week, this food plan provides an adequate diet. They looked at families with moderate spending on food between the 25th and the 50th percentiles. They then adjusted for the age of the family members and assumed that all food was prepared at home where it would be cheapest. Again, part of the conservative formula that they used. One limitation of this calculation is that it's based on a statewide average rather than San Bernardino alone. They calculated that the basic diet would cost $577, or 12.2% of the monthly budget. Now to child care. Child care expenses were based on California Department of Education estimates of how much it would cost to provide full-time care for one preschooler and after-school care for one school-age child, with full-time care during the school breaks. There is a 7-year-old. They adjusted for the age of the children and adjusted for regional cost differences within California. And over the years that I studied this, it was always quite interesting to me that there wasn't a lot of difference in childcare. I'd often, when I had students work on these projects up in the Napa Valley, I forced them to base things on Napa Valley expenses. And one of the complaints was, yeah, but I live in Fresno and it's a lot cheaper in Fresno. And so I talked to them and we talked about how, well, wages are lower in Fresno too. But one of the things that was interesting to me was childcare wasn't less expensive in Fresno, and within several dollars. So it was always kind of interesting to see how that worked out. One thing that I remember also while I was doing this, and Lisa may remember this, it was quite a relief to me financially when our second son went from daycare to private school. It was a lot cheaper. To me, it was just one more reminder that to have, and we had good daycare, but it's expensive, very expensive. All right, so where was I on this? They considered licensed family care homes only because these are the least expensive form of licensed care. So again, taking a conservative approach, going with the least expensive licensed care, but not so conservative, expecting, we want licensed care, not unlicensed care. So in the end, they calculated this licensed care would cost $1,166 per month, or 24.6% of the monthly budget. So you can see how free or low-cost daycare would impact the ability to afford work. Family insurance, with the employee share of costs coming from premiums, co-pays, deductibles, and prescription medication costs. And with this calculated cost of healthcare was $423 per month, and that accounted for 8.9% of the monthly budget. Transportation costs were based on data from Consumer Expenditure Survey, adjusted for residents' typical commute by county, adjusted for age of the family members, and adjusted for regional cost differences within California. And they covered fuel, maintenance, insurance, and other expenses like license fees were included. The cost of purchasing a vehicle was not included in the calculations. We're just assuming, oh, thank you. Should we do that again? So, expenditure survey, adjusted for a commute, and then fuel, maintenance, insurance, and other expenses like license fees, not taking into consideration what it would cost to purchase a vehicle. So that accounted for $437 was the monthly cost, and accounted for 9.2% of the budget. As any person who's managed a household budget knows, miscellaneous expenditures are messy. And they're potential budget breakers. Anyone run into that? Miscellaneous expenses were based on data from Consumer Expenditure Survey, adjusted for ages of family members, and adjusted for regional cost differences within California. Covered things like clothing, housekeeping supplies, and personal care items. It also included costs that have to be covered when attending public schools. So we usually think of public school as being free, but it's not, especially as good Californians did to our public school system with Prop 13. A lot of expenses end up getting covered by families, and I've worked with families that are here or have less income than this, and a lot of discussions are around what can I afford for my child to do, and how am I going to manage letting my kid take a sport or go on a field trip that costs money, all those sorts of things. It includes phone costs, a landline and a cell line. So I think this is probably one of the expenditures that isn't real conservative, but they didn't break it out, so I couldn't break it out. Nowadays, a lot of people are just going with the cell phone, but it includes both. And basic internet service. Basic internet service and $35 for everything else. You look at those categories and then think, everything else, we'll give them $35 to cover that. So that's a lot of things. Things like charity. I don't know if you've been in gathering. We had kind of a conversation with someone last year. In gathering in poor versus more affluent neighborhoods, where did you get more money or more donations? It was always in the poor neighborhoods that I noticed. Charity is important to them, even though they don't have much they want to give. But hitting closer to our current day, it doesn't include buying gifts for birthdays. It doesn't include Christmas gifts. Note that the calculation also does, so that's in that $35, but the calculation also doesn't include some other things like vacations, big ticket items like furniture, electronics, or appliances, or savings. Savings for emergencies or savings for retirement. So a very conservative budget in terms of miscellaneous expenses. And with this, the calculated cost of all miscellaneous items, and we have to throw in a generous amount of impulse control. You have a budget of $463, and that makes up 9.8% of the total budget. And for our final category, we have taxes. And taxes were based on the income needed to cover all the other budgeted items. So you have enough income to cover all those items. How much tax are you going to have to pay on that amount? Also accounting for the tax that you pulled in. Have to be able to pay. Total tax bill included income taxes and payroll taxes, and the calculation does not include the federal earned income tax credit, the federal additional child tax credit, or the California earned income tax credit. You may say, well, why don't you include those tax credits? Because those are part of the tax system. Well, it's because those are government benefits. And you may remember I said that this budget is calculated based on the assumption that the budget the family is not receiving any government benefits or support. Sometimes we like to think about welfare as being government support, and our interest tax deduction we get on our homes and our tax credits we get for children aren't government welfare, but they are. Okay? We all benefit from that. In fact, the interest tax deduction that we receive, the amount of money that's spent on that by our federal government far outstrips the Section 8 public housing budget. So much more money goes to supporting people like us who own homes than it does go to support poor people who need help with their housing. No comparison. So with this family's tax bill, it would come out to $469. That accounts for 9.9% of their budget, which gets us to our total monthly budget of $4,732, and that hourly wage of $27.30, and an annual income of $52,416. That's how we get to those numbers, as big as they seem, as unrealistic as they seem. I think it's a pretty conservative estimate of what might the actual living wage, a true living wage, might be right here in San Bernardino, California. Not the most expensive place to live in California. And so with that, I'm ready to take your comments and questions.
Thank you. I think we had Hedrick first and Donna second, remember?
Oh, from last
week. We made those
week.
commitments last time. So Hedrick?
I'd like to defer to her first. Loma.
Okay, Donna, where's Donna? Over to Donna.
How very kind. I have totally forgotten. So please.
Okay,
Henry, go
just a
ahead.
comment before Roger speaks. Those of you who are administrators would know what an instructor at Loma Linda University Health receives. That person who receives $60,000 a year is just barely making it, right? So you folk know what the numbers are. I don't know.
No,
I
observed. I was just deferring to her.
Oh,
he wants to- we
okay.
wanna come in.
Okay, Roger, and then back to Hedrick.
Go ahead. Well, go ahead.
There's no room for tithe or offering for a Christian in that budget.
No, there's not.
And that's an important thing for one who's committed. So that even reduces the amount. Now, I know there are people who say, well, the Lord will make up for that. And maybe, well, I don't know, but that could be a pretty big item.
That was an issue that I had with my students, because I had them balance a budget, or I had them create a budget. How much would it cost you to live? Before we had this discussion, and many of them included tithe. But then I said, okay, now based on a job that as a class we found, said now you have to balance the budget. So what are you going to cut? And so that forces students to start making decisions about, are they going to skimp on food? Are they going to pay tithe? And those sort of things. So it always came up. I think we're going to come back
Yeah,
here.
you've given us a lot of information, factual information to process. And it's helpful, very helpful. But I want to ask a more generic question. I don't know if you can relate to it. And that is, Jesus says that the poor you always have with you. And I wondered what is the basis for that assertion? Why would the poor always be with us? And does that absolve us from some of our responsibilities? I have some comments on it, but could you talk a little bit?
You want to
about
give your comment and then?
Well, I think that there are probably 2 or 3 reasons why. Maybe he thought the world was already so screwed up that you can't solve the problem. Another reason might be for those of us who claim to be disciples of his, to test our conscience and our commitment to the least of these, which is one of the acid tests for his kingdom. Didn't he say that? Yes. So I just wondered whether this is something that God has a hand in, not that he caused it, but that he says it's going to be so for some of those reasons.
Seems like a lot of the problems that we have, that God doesn't seem to have to get involved in it for us to mess things up.
Well, he says so. He said that he's describing what will
Well,
be.
is he, or maybe he's just being a realist and understanding the way things will be, is that
Okay.
you guys aren't going to take care of this. They're always going to be with you. Don't worry about helping them. There will be more. What I did, another part of your question is, well, then does that absolve us from having help? In the example, and being a Christian, a follower of Christ, it didn't absolve him from caring about the poor. So I think through his life, he essentially told us what to do. It doesn't absolve us from being concerned about them. It was the focus, it was a key focus of his ministry.
Just one last comment, and that has to do with the hope. Well, I was reading this book by Lewis Smedes, Standing on the Promises, and Keeping Hope Alive for Tomorrow We Cannot Control. And he does address the question of poverty in this book and hope. And it seems to me that one of the suggestions that has validity and relevance to Seventh-day Adventists is the idea of creating models of the kingdom that we cannot solve. We will never be able to solve all the poverty problems in this current world. As I said, it's pretty screwed up already. But as citizens of the kingdom, we can create imperfect models of the future. Just like the sanctuary given to Israel was a model of something bigger, providing hope that as a church, as the Christian community, we can build models of that kingdom that will give people hope. And we can do it on the local level, in a local church, in a community like this where we have a lot of resources and a lot of wealthy people. We can create a model here that can provide hope, even though we can't solve all the poverty problems involved.
Thank you. And I would take that one step further and say not just hope, but I think if we choose to, we can create imperfect models that also reduce hardship as we have hope for a better future.
That's right.
Maybe we can take a couple of more here and then go over to that side so we don't have the camera swinging back and forth, okay?
You're focusing on purely financial numbers.
Yeah.
You're not talking about quality of life. For example, last week I thought your cost of housing was terribly low considering California. And the cost of housing is a variable depending on how safe you want to be when you go home. And so that's a significant factor that feeds into quality of life. A second is the commute time. Well, if you do have a job, you have commute time and downtime, which lowers your free time for whatever life enhancement you want to do. So that not only commute time, but if you have 2 children, the time to pick them up and get them back to home and things like that. So I'm uncomfortable with this being purely financial.
One thing I think is that the numbers, for me, I don't see the numbers without the hardships as well. And so that's one reason why Eden and Elaine talked about the hardship factor. And so for me, they come together. And maybe it's just because of the way my brain works, but when I see the numbers, I can also see that, and my experiences, see that number reflected in people's lives. Now, with commutes and things like that, we all experience commutes. And if it's a single mother and an expectation that she's going to work, well, there's going to be commutes, and there's going to be less time to spend with children, just like for all of us. We have children and we work, we have less time to spend with our children. Those are
Okay,
very
one more on
important.
this side, then we'll go to the other
But-
side.
But I would say those a lot of the numbers to me reflect a lot more than a number. And you're right. Not being able to afford very much rent means you're not going to be able to afford some neighborhoods, which means your children are not going to have the same schools that are going to be in other neighbors. All these things have implications like that.
Before I make my main comment, I had a treasurer of a major conference in I'll put it that way, because he didn't want this study to be released. He tried to figure out a sample budget for an Adventist family to see if they could afford to go to an Adventist school. And he found it impossible. If they paid tithe and tuition. In some cases, if they gave up the tithe part, they could afford the tuition. So that was the dilemma his own brother, this treasurer's brother, has been left with. So it's not a study he was happy to share, because it proved that many Adventist parents just could not afford an Adventist education, which then has a ripple effect to enrollment in higher ed as well. Even though it's cheaper, it's easier to go to higher ed because you can get all kinds of funds to do that than it is for K-12. I wanted to talk about what I talked to you about last week a little bit, and I don't want to take this totally off the topic, but that's the issue of food security on higher education campuses. I first experienced being exposed to this at Fresno State University, where they had developed a massive program for helping students with food needs. One study indicates that as many as 40% of all students in California State University campuses have food security issues. 11% are homeless at some time during their time in university. And the efforts that have been made by places like Fresno State have been phenomenal, with huge food pantries and huge workshops and resources and health seminars and the like to try to help with this problem, because they've had thousands of students that have had food needs, just basic food needs. So it starts even earlier than the single parent with 2 children. It's even in higher education. I was telling you about one interesting app related to that. You know, when we at PUC in the President's House, we would have receptions and food, and we would just take it to the dorm when we had leftover food, and it would be eaten up very quickly. But that's against health regulations. And so at Fresno State, they actually have an app. And when there's a big reception, and the student is in a food insecurity situation, has been able to sign up for the app. Notice goes out, says food in X room, it's leftover food from a reception for 30 minutes. And that's one little example that they've used to deal with that challenge. So Monty, I know you've done some reflections on this as well when you were at PUC. Could you reflect a little bit on the relationship perhaps between students already starting with these issues when they're trying to get their higher education degree, and then becoming parents and experiencing these same kinds of issues?
Well, it starts earlier than that too, because one of the reasons we have no-cost breakfast at elementary schools is because a lot of these kids are coming from homes where they're food insecure, and they're going to do better in school if they're not doing it on empty stomachs. So it just goes all the way through. So you're talking about starting at college and then going into families. Well, it's a full cycle. It's not generational poverty isn't as much of multi-generational poverty isn't as much of a deal as we think of it as. Being low income, well, dependence on welfare is not as intergenerational as we think it is. But being involved in this low income, low wage work environment is fairly cyclical. So you'll get students who students in elementary school who come from families experiencing poverty, and they struggle all along. They may or may not, with support, be able to end up at college. We're dealing with people who are in a bit of a better situation many times. But then they become parents, and if they're not able to get into a high-paying job, a good-paying job, then their children are likely to experience as well. College education, that's a lot less likely to happen. It's one of the benefits of supporting people through higher education. It tends to get people out of the low-wage work level, which again is another one of the goals in terms of social capital. How do we move people from welfare to work, getting people enough education where they can get a job that helps them leapfrog low-wage work into a little bit higher wage work that comes with benefits. Right here.
I'm sure you sort of understand the complexity of this problem, because as you were talking, I thought of several of them. I mean, they're the entry-level jobs that are purely entry-level for single persons that are just entering the workforce and who don't want to be educated. And then
Don't want what?
There are many people I know graduating from high school who just want to go out and work at McDonald's or want to earn something, and they're quite content initially to flip hamburgers. I don't think a couple years later they don't feel so good about those jobs, but I think there are these entry-level jobs, or high school kids that are working after work, etc. There's that level of job. But you're obviously talking about a different group of people, someone that's probably 7, 8 years older than that, who finds themselves in an unfortunate position. But I think in that complex situation, there are probably a fraction of them that are getting child support that you didn't put into your calculations. And I don't know how much child support one can expect in this kind of situation, but I know that that's an important source of income for some people. You know, as you were talking, I'm sort of thinking about what we can do as an institution. And it seems to me that we Adventist people have not worked as hard as we could to have a part of our educational system be cost-friendly enough that we could incorporate people into our system who, because they enter the Adventist educational system, will become successful, will be able to become medium and high earners. And it seems to me that you know, you can give as much money as you want to, but there'll always be the poor. You can't give enough money to. But the thing that we're especially, I think, as Adventists equipped to do is to provide education at a reasonable cost. And I think we do a terrible job at doing that.
And yet, I think we have some people who've been local pastors here. How much of your church budget went to the local elementary school? You know, there's always more that can be given. I do want to raise a couple issues, and one, I think the one that I'll remember at least, I want to talk about, and that's the idea that there are quite a few people out there that don't need more income from these, so these entry-level jobs will work for them. Well, first of all, look around you when you go into a Taco Bell or McDonald's, and not all those people are teenagers. But it's all too easy, I think, to classify people. These people need income and these people don't. It reminds me back of our press up in San Jose area, Mountain View, where we said, we don't need to pay men and women the same because the man is the primary breadwinner, so we should pay them more. The other person doesn't need as much income. It's very convenient to make those kind of distinctions. And I think those kind of distinctions get in the way of thoughtful conversations about the real lived experiences of people. It feels better, but it's an out that we often want to take, and I think we need to look at the issue with those things on the side, because that's another issue. That's my perspective on that.
I was horrified when I realized this budget growing and growing, this conservative budget growing and growing and growing, and
Did you think it was conservative? How does it come across?
Well, no, I'll tell you what, I think it's very rosy. I'm thinking of this single mother. She comes home, she has to cook. She can't just buy stuff that's already done. She has to cook. Now the plumbing is backed up, and when is she going to get that fixed?
It's not in the budget.
And now Simon and Garfunkel said, there were times I was so lonesome I took some comfort there. What if she gets pregnant? What if she gets a parking ticket? I mean, there's just 100 other unexpected expenses. What if our children can't go outside to play because it's such a dangerous neighborhood? I can't say more.
You make a very good point, and the authors of Poor Economics, I read a quote from them earlier. Their book is about poverty around the world, so it's a different issue. But they make the point, and I think it relates to what you're talking about here, and that is that a person living even on that living wage budget, single mother with 2 children, isn't struggling because they don't know how to manage money.
Or because they're lazy.
Or because they're lazy. It's hard to do. To make that work, they have to be very smart, strategic, patient. It takes a lot to make it work. And that's why they said in the quote, where is it? It's, I have it right here. The economics of poverty the economics of poverty gets mistaken for poor economics. And in their book, they give many examples of where we have people who are poor, but it's not because they're poor at making economic decisions. They're making thoughtful decisions given their circumstances. And if we want to intervene, we need to understand their circumstances so the interventions make sense with the circumstances that they have to live with. They're very diligent and frugal.
Well, a question was raised here, very important in my view. Why Jesus said that you have the poor always with you? And now continuing with this thought is, did Jesus really wanted the poor to have the poor continuously? Did he agree with this problem? And my answer is no, because he had ability to solve the problem of poverty. He was feeding thousands with 5 loaves of bread and 2 fishes. Then he couldn't solve this problem, but this world had more than the problem of poverty to solve. And we have to keep in mind that what kind of leader was Jesus? Jesus was not a social political leader. He came to bring a kingdom of God that has a spiritual dimension. When Jesus was preoccupied with our moral, with our spiritual renewal, when he told Nicodemus that you have to be born again. And as Apostle Paul said it so beautifully, you have to renew yourself in the spirit of your mind. Then this is the main problem that Jesus was dealing with. Our spiritual renewal, the sin that was creating so big problems on this planet. And Jesus himself gave an answer to this problem in one of his parables, when he said, you don't put a new patch on an old garment. Then it was not just one spot to take care of it. It must be renewed, the whole planet, that is such in big trouble.
You know, I'm really sorry, but there's time only for me to make a comment. I don't know what the New Testament people would say Jesus meant about the poor always being with you. I know what that means to me. It means that the relative poor will always be with us, and a case can be made that it's a good idea to have the relative poor with us. That builds in certain incentives into the economic order that I think helpful. But we don't have to have the absolute poor with us always. People should be able to have food and clothing and housing. They may vary on how nice that is, but they should have the basics. Now that you've had that, we can have the benediction.
Just, again, Monty, thank you so much.
Pleasure.
Will these be available
Well, they'll be on the video. If
Well,
people,
okay.
I can share the
David, I
slides
think
with
these are very
David.
good. Okay,
Could I, oh, I'm sorry.
yeah,
Go ahead. Then I want to say one word about Dr. Branson. Go ahead.
no, you please, go ahead.
Well, he is ill, but he's been in the hospital for 3 weeks. So when a person's in the hospital for 3 weeks, him about 6 days ago, but he's slowly coming back. So we need to think about him and pray about him. Drop by, leave a card. He's happy to hear from you, but he's very, very frail.
Where was he?
He's in 7200 yesterday. He may be moving over to rehab, so check at the desk.
Okay, well, thank you very much, David, and again, Monty, thank you, and make arrangements with David to get that. This has been very enlightening. One of the things that I wish, just compare now with the 60s. What are the differences? Because, when I was in university, a person who worked on the assembly line at General Motors could send their kid to a state school.
I'll tell you, one of the biggest differences that happened in the 60s was we got, with Social Security and Medicare, is poverty of elderly dropped way down. Interventions can make a difference.
All right, we'll have our benediction at this time. The Lord bless you and keep you. The Lord make his face to shine upon you and be gracious to you. The Lord lift up his countenance upon you and give you peace. Amen. And don't forget, next week we're going to have Thomas J. Ord, who will be here in the morning and in the afternoon as well. So, and he'll be speaking about nature, theology, and photography. So,